Guys, welcome back to Clinically Clear. So today let's cover iron, extremely important. What is the function of iron? We all know heme synthesis. You have heme iron, non-heme iron. Heme iron, Fe2 plus, much better absorption seen in animal sources. Non-heme iron, Fe3 plus, seen in plant sources like pumpkin seeds, dates, green leafy vegetables, food made cooked in iron vessels. That's why they always say cook in iron, cast iron skillet, cook in cast iron vessels. Will increase iron content in the food. So these are all non-heme iron Fe3 plus, which is it is good. It's not a bad source, but animal iron is much better. Animal sources of iron. RDA depends on the age. If you want, you can memorize that. Iron deficiency anemia due to decreased dietary intake. Very poor diet. Instead of giving the child breast milk, you're giving cow milk. In old age, appetite has decreased so much that there is barely any dietary intake of iron. That is due to decreased dietary intake. Due to increased demand, pregnancy, growing children, increased demand of iron. Due to blood loss, you're losing iron through blood loss, through hemorrhage, menstruation blood loss, occult GI bleeds, hemorrhoids, then worm infestation, hookworm infestation, sucking blood from the intestine. So blood loss can lead to iron deficiency anemia, and decreased iron absorption itself, like calcium inhibits iron absorption, phytates and oxalates in vegetables inhibits iron absorption. Malabsorption syndromes like Crohn's disease or celiac disease, tropical sprue, all that can lead to decreased absorption as well. These are causes of iron deficiency anemia. When do we say that there's iron deficiency anemia? 11, 12, 13. Less than 11 in pregnant women or children less than 6 years of age. Less than 12 in non-pregnant females or children more than 6 years of age. And less than 13 in adult males. This is the hemoglobin cutoff for anemia. 11, 12, 13 if you remember. Pregnant, less than 6 years. Females, more than 6 years, 12. 13 for adult males. Clinical features of iron deficiency and anemia, all of us can cook it up. Pallor, fatigue, headache, no concentration, loss of appetite, spooning of nails, tachycardia, palpitations, exertional dyspnea, basic clinical features. Prevention and control, first of all, you have general health education where you will give nutritional education to the pregnant and lactating women. You will give ICDS nutrition supplementation. You will educate them about cooking in cast iron vessels, etc., to increase iron content. General health education. Now coming to the specific protection. Double fortified salt. Already salt is iodized. If I also add ferrous sulfate to the salt, iron and iodine in the salt, double fortified salt. This is one crazy method. Next one is Anemia Mukt Bharat scheme, comes under the National Poshan Abhiyan. Here the thing is 6 into 6 into 6. 6 beneficiaries. Children from 6 months to 5 years, 5 years to 10 years, 10 to 19 years, that is adolescents. These three both males and females. After that, 20 to 40 years, only women, the two those under the Mission Parivar Vikas, who have registered under that. And of course, pregnant and lactating women. So 6 months to 6 beneficiaries. 6 months to 5 years, 5 years to 9 years, 10 years to 19 years, 20 to 40 years, women in reproductive age under Mission Parivar Vikas, pregnant women, lactating women. 6 beneficiaries. 6 interventions. Most important one is iron and folic acid prophylactic supplementation. Okay, this is not therapeutic supplementation. Prophylactic supplementation, absolutely free of cost, available in PHCs, Anganwadis, etc. See, pregnant women and lactating women and women of reproductive age group, elemental iron 60 mg and folic acid 500 micrograms. Just that pregnant and lactating women you will take daily. Pregnant woman you will take second and third trimester. Lactating woman you will take 6 months of lactation. Okay, 6 months postpartum. Women of reproductive age group, yes, same dose, 60 mg elemental iron, 500 microgram folic acid, but weekly. Adolescents also 60 mg elemental iron, 500 micrograms folic acid, but weekly. Now the dose reduces. 5 to 9 years old, 45 mg elemental iron, 400 microgram folic acid weekly. 6 months to 5 years, 25 milligrams elemental iron, 100 micrograms folic acid bi-weekly, once in 2 weeks. So very less. Okay. So this dosage, this table is 10 star, 5 star, 3 star, superb, very important NCQ, iron and folic acid supplementation. Biannual deworming, this is also equally important. Less than 2 years of age, biannual, twice a year we'll do deworming. How? Through albendazole, deworming tablet. If the child's age is less than 2 years, half tablet, 200 mg. More than 2 years, adult dose, more than 2 years, pediatric dose, everything same thing. That is 400 mg of albendazole. Biannual deworming. Then solid body and smart mind through what? 4 key behavioral changes. This is important. So delayed cord clamping. We delay the cord clamping by 3 minutes so that the umbilical cord blood with extra hemoglobin, extra iron goes into the baby. Improving the compliance in general population to iron and folic acid supplementation. Appropriate feeding, adequate feeding to children, and increased feeding of iron rich food. So these are all the behavioral changes that can lead to a solid body and a smart mind. And this Anemia Mukt Bharat scheme is an intersectoral coordinated project. You have 6 institutions coordinating with each other. So 6 into 6 into 6. 6 beneficiaries, 6 interventions, and 6 institutional mechanisms. Okay. Then another strategy is prevalence categorization. This is just a table you have to memorize. Prevalence of iron deficiency anemia less than 5%, no problem. 5 to 20%, mild public health problem. 20 to 40%, moderate public health problem. More than 40%, severe public health problem. Simple. You categorize an area based on how big of a public health problem iron deficiency anemia is based on its prevalence. Okay. Early diagnosis and treatment. Early diagnosis and treatment is basically signs and symptoms. Early diagnosis, how we will do based on signs and symptoms. Then hemoglobin percentage. Hemoglobin percentage is the epidemiological most common indicator for iron deficiency anemia is hemoglobin. But hemoglobin can reduce because of other causes of anemia as well. So if I want to know this is iron deficiency anemia itself, I'll look at serum ferritin, serum iron stores. Okay. Treatment, mild anemia 9 to 11, just give oral iron tablets. Moderate 7 to 9, give injection of iron. Less than 6, severe anemia, give direct blood transfusion, don't give iron. Direct blood transfusion to replenish hemoglobin. So early diagnosis and treatment. Okay. Early diagnosis and treatment, prevalence classification, Anemia Mukt Bharat 6 into 6 into 6, double fortified salt, general education. Thank you for watching.